our vision for this is really for Kismet to become more of a collaborative care technology, where you're able to actually facilitate sort of e-consults, curbside consultations, clinic to clinic, asynchronous using video. I think, we love to tell this story, and actually I wish Sierra was here to tell this. When she was practicing as a child psychologist, she was oftentimes the last stop before a kid got sent to residential. And she had this kiddo who had been, inpatient, outpatient, four different systems of care. And, she sat down with the kiddo, and within the first 20 seconds, she noticed that there was this interesting facial contortion. And, she's done thousands of assessments and was like, this doesn't seem actually behavioral. There's something else here. And with the parents, of course, consent and assent, which is something that we feel very strongly about, she took a 20-second iPhone clip with her iPhone and ended up sending it over to the county neurologist. And, at 9 p.m. that night, he calls her in her home and is like, get this kid in my office tomorrow. I think this is a brain tumor. And this is where, with a 20-second iPhone clip, she was able to help save this kid's life. And so they end up operating immediately. They were able to save his life, but he also had years of sort of fallout from the medication that he was, inaccurately prescribed and all these things. And so this is where we see the power of Kismet is, soap notes and just written notes can be highly subjective. But, if you say that a picture's worth 1,000 words, a video is worth 30,000 words, and being able to use that to do curbside consultations or sort of these asynchronous consults. I think especially as we're getting into a point where there's such an increasing workforce shortage, especially within pediatrics, last year, 30% of pediatric residency roles went unfilled. And so as we're getting less and less, physicians entering the field, how do we use their time more wisely? How do we think about optimizing and streamlining these workflows, making more efficient, and really getting, sort of faster time to accurate diagnosis, but also the right care at the right time. And that's really the big problem that we're ultimately trying to solve. A use case, an example is we see a lot of school districts, right, who of course are looking for providers to be able to help deliver quality care, whether that be mental behavioral health or other aspects. And so it typically is the point of care starts with, let's say, the school nurse, and then they use Kismet essentially to patch in to a provider group. And so we're using the telehealth consult right there, but it's much more engaging, delightful, higher retention rates, higher, outcomes or better outcomes in general. It's not that a school necessarily has an EMR. So how do we think about the data exchange, and how does that get back to, the family, the patient, the school, or whomever needs to have that, and then of course the clinician themselves. And so this sort of data exchange or infrastructure layer is a really core value proposition that we provide. As we talk about a number of, whether it's rural or urban, we see this actually with a lot of our customers who are in both, where, you might be in a multi-clinic office in New York, upstate New York, and it's you're driving to the next county to try and find the one pediatrician, or same thing in downtown LA, where you're sitting in an hour and a half of traffic and you can't just go down the hallway and ask for the pediatric neurologist, and so having this type of technology really helps to drive those e-consults or kind of curbside consultations. And so those are sort of the top use cases that we're seeing right now, and sort of I think where the industry is headed.